A very good evening to all our viewers who are just joining us at Kopi Events. As usual, before I start, I have my coffee cup, and I'm also sure my guest speaker today will be having a coffee cup as well, but I'm not sure what will be inside. Let's check with her in a very short while. But yes, today's topic it's going to be what's your mouth telling you. Very excited to share this piece of news with you guys and girls out there. We are live in Spotify as well as podcasts as well. So if you type in Kopi with Vans, you can find us and you can hear them at any time, any place, anywhere. So, without any further delay, I'm going to invite Dr. Ramithaa Venu. Hi, Dr. Ramithaa Venu.
Hi, Vance. Good evening.
Good evening. So now I got to be very conscious because I know you are a dentist. So my teeth. I'll be telling you later about that. But today's topic, right? It's about what's your mouth telling you. But before we even jump into the topic, if you can just do an introduction of yourself so that our viewers will know who you are.
All right. First of all, thank you for having me here. A little about myself. My name is Dr. Ramithaa. I am a general dentist, and I've been practicing for about 5.5 years now. And I first started my journey as a dentist in the government sector, where I served the government for about 4 years. Where 2.5 years I was in a clinic in Ipoh, my hometown, Clinic Pergigian Kampung Sini. It was also attached to the restorative specialist department. I gained a lot there, learned a lot there. Following, I got absorbed to be a permanent officer and I was transferred to Sarawak. It's a lovely place, wonderful
Okay.
people, wonderful colleagues. And I was in Hospital Cebu, the oral maxillofacial specialist department. I was the permanent officer there. So I gained vast experience learning from one of the top specialists actually in the country, and also with an amazing team. And following after my experience over there, I realized that, I think it's time for me to venture into the private sector. That's when I left the government and I joined the private sector early of last year. And I've been working in the private sector of dentistry in Malaysia for over a year now. And I'm currently based in Penang, Batuat, and I'm working in a dental clinic here as well. So
Thank
that's
you,
about.
Dr. Ramita, for the lovely introduction of yourself. And yes, we are going to come to the topic today. Of course, we have decided on the topic of what's your mouth telling you. But for before we really seriously get into the topic, on
Mhm.
the lighter side, most of the time the mouth will be only telling put in the sugar drinks, put in a lot of food. But for
Yes.
you today it will be a bit different. We got to be certain SOPs. Brushing in the morning, after lunch must brush teeth, after the snack must brush teeth, evening must be. Oh, it's going to be very tough. So we're going to find out all these
Mhm.
information from you with so much of experience that you have. So let's get started up with that. And we are also with Spotify and Apple Podcast. So viewers watching this, please do share and like so that many more will be benefit from this talk session as well. Today with me is Ramithaa Venu. We're going to talk about all about the topics on what's your mouth is telling you. So I'm going to jump into the first part of the topic. I mean, in the
All right.
segment itself. What is dentistry? I mean, before you answer that, doc. I mean, I'm going to tell you this. I'm going to confess. I'm,
Okay.
I'm sure it's going live, but I got to confess this. I always have this kind of phobia.
Okay. All right. Mhm.
Okay, deep breath. Okay, whenever I got a dental appointment during the
Mhm.
school days, right?
Mhm.
I will not turn up. Stomach pain, head pain,
Mhm.
good stomach disorder, and all these things will come in. But nowadays, I don't scare dentists at all. Why is that so?
I have to ask you that question actually. All
So
right. So actually,
they're not scary at all. Okay, that's not
yeah.
scary.
So
Jumping
actually, it's
into
a very common thing. It's very prevalent. A lot of people have dental phobia, dental
yeah,
anxiety, and sometimes it is so serious in some people that they actually cancel their appointments and they don't show up until the last minute, where it's actually an emergency situation, and we have to actually carry out like extensive procedures, which is actually going to add on to the dental trauma and their dental fear. So I'll talk about that a bit later.
okay.
So yeah.
So so coming back again, I know the our beautiful teeth. The smile is all very important. But dentistry, what is it exactly that you do? I know we have a lot of
Mhm.
questions. Viewers also can engage Dr. Ramithaa Venu for all the questions. I know there are a few questions that's already coming in, which is good. But what is that, doc? I mean, what should we all know, in terms
Okay.
of dentistry?
Okay, so dentistry is basically any diagnosis, treatment, prevention related to the mouth, which is like your oral soft tissues, your gums, your oral mucosa, which is like the inner part of your cheeks, and also, of course, your teeth and any tissues related to actually the head and the neck. All right, so that is basically dentistry. So we actually diagnose, we treat, and we prevent diseases associated with that.
Okay, and okay, we will come back again on in terms of dentistry, but you know, um, how important it is. I know teeth is very important for us, but those who are taking a bit on the lighter side, is it a serious condition or a serious matter to take note of that?
Yes, of course. Your teeth is very important. I mean, your dental health actually affects your overall well-being. Okay, so like why I say that. Okay, first thing you wake up in the morning, like of course you're gonna be hungry and you want to eat. So you
Hmm.
need your teeth to chew your food, and you need your teeth to like break down like large particles of food into like smaller particles to
Yep.
aid in digestion and things like that. So just imagine a situation where you actually don't have your teeth, right? Like you won't
Hmm.
be able to eat so many different types of food, things that you're actually craving, like you're unable to eat those kind of things. And in the
Hmm.
long run, like it's actually going to affect you because like you're not feeding your stomach and also you're not feeding your soul. Because like I think like food plays a very important part, especially for us Malaysians. Like
Hmm.
if you are not able to eat something that you really want, I think especially when you're craving and things like that, is really going to affect you. Another one more thing, your teeth, why it's important, which a lot of people overlook this until they actually lose their teeth, is it actually affects the way you talk. It affects your speech. So for instance, like let's say now we are
Right.
talking, right?
Yep.
Actually, how is it that we can enunciate words clearly? Is because our tongue is actually rolling and it's hitting against our anterior teeth, and like words are able to flow out smoothly. You're able to enunciate. But just
Yep.
imagine a situation where you don't actually have your front teeth. You're going to end up having a lisp, and you're going to have difficulties in enunciating and pronouncing certain words as well. And of course, another one more thing is your smile is going to be your visiting card, right? So your smile is very important, and basically gives you confidence. I mean, if you've got a really
Right.
nice smile, you're happy with your teeth, it's going to look, it's your outlook, right? So it
True.
can greatly affect your mental health. Actually, dental health and mental health has a huge correlation to it. Yeah.
Okay. And I know we are going to talk about that as well because
Yes.
there is some kind of a relationship between the both of them.
Yeah.
When you talk about mental health, they say, "Hey, what to do with with teeth? Teeth is too got nothing
Yeah.
to do with mental health." But we're going to come back there. Yes, we are now going into a little bit more deeper. We are
Mhm.
It's very important, but
Mhm.
even as younger time as we grow up to 17 or 20, 24, there will be one or two times that we will lose our teeth. Am I right to say that? Then after that the tooth will never grow up again or something?
Okay, that is actually your deciduous dentition, your milk tooth.
Hmm.
All right. So when we are born, we're actually born with two sets of teeth. One is your permanent dentition, all right, and one is sorry, your deciduous dentition first, which is your milk teeth, followed by your permanent dentition, which is the teeth
Okay.
that we have now as adults.
Okay.
All right. So your permanent dentition, all right, if you lose it, it's not going to grow back. All right.
Hmm.
Your deciduous dentition, you will eventually lose it. You'll start losing it. It starts with the lower front tooth, all right, around the age of 6 to 7. For some kids, even
Okay.
earlier, some even later than that. So it really depends. So your deciduous dentition, which is your milk tooth, yeah, that one you definitely will lose it up to the age of maybe 14, 15. But there are some cases where some people, some patients, they come in and they actually require extraction of their deciduous dentition, which is their milk tooth, because there's something called as over retained deciduous teeth, where the teeth that is supposed to shed has not shed yet. It has not exfoliated yet. So we have to assist in the exfoliation process with an extraction to allow the permanent teeth to erupt. So basically, the deciduous teeth guides the eruption pathway of the permanent teeth.
Okay.
Too
All we
technical?
know, Doc, I got to tell you this, right? I'm sure our viewers also will agree. All we know is the teeth is just biting food, and we just have to brush in the morning, and then we got to brush in the
Okay,
night.
yeah,
Some are
definitely.
trying to save water. They don't even brush in the night. Also, continue in the morning. So we are going to talk about that as well
Yes.
in terms of hygiene. So yeah, so let's put this topic aside. We will come to you right now. I know that before you start work, you're always working in a very tight space, which we'll
Yes.
go in later. But tell us about this PPE. You seems like going for a war where your dental assistants will keep all those medical tools or equipment where you call, and then they're standing by with the PPE, with the shield, with the mask, with all the protection. What is this all about? Is it a must to do all these necessary SOPs?
Yes, it is. Actually, we have been practicing this even before COVID, just that, like when COVID came, it became more prevalent and, everyone started, taking it more seriously. People, the general population became more aware of what is actually PPE. Since my student days, I have been wearing PPE throughout when I'm treating patients as a student. So basically, why you need PPE? So PPE is personal protective equipment. All right, you need it to protect yourself. So I'm wearing it to protect myself. All right. So because when patients come in, like especially when COVID happened, all right. The patients come in, we don't know, like let's give an example, COVID, all right. If sometimes the patients don't even know they have COVID, right? And we have to treat each patient, all right. It is not infection control, all right. We talk about infection control, all right. Infection control is not patient specific, all right. It is
Right.
procedure specific.
Wow.
So anything, because dentistry, basically all our treatment, we're using the hand drills, the scalers, is generating a lot of aerosol, all right. And that is one of the common ways where you actually contract COVID, right? So actually, during the pandemic, a lot of dental clinics had to close down for a while. A lot of people had to neglect their dental appointments, and there was actually a lot of
Okay.
dental health
Yeah.
problems that arise during COVID.
Mm.
All right, yeah. So basically, okay, back to the PPE. So PPE is to protect ourselves. So basically, when I go to my clinic, the first thing I do is, of course, I wear my face mask, and then followed by my head cap. All right. One thing why we wear the head cap is because we don't want our hair to be falling all over the place, when we are
Mm.
doing the dental treatment, and
Right.
also the aerosol spray. And then we wear our gown, our surgical gown,
I see.
and then our gloves. Yeah, and
Right.
face shield, of course.
And this you have to wear throughout the entire day. I mean, as long you have
Yes, yes, we do.
someone is on
And if
your.
let's say the procedure is for the patient, there's a lot of spillage, like there's
Yeah.
like splattering of a lot of saliva and
Yeah.
blood and all that. You have to change your
Right.
PPE. Usually, we change our PPE like with each patient.
Right. So
Because we do
that's
not want to. Yeah.
so that's the first thing that you do before you even. I mean, of course, you step in your clinic and you wear all these PPE. Getting ready for the war, something like that, right? You're getting ready everything. But there's a very interesting thing about your tools, or rather your medical equipments that you call. I know
Mm-hmm.
that you have many, but I'm going to name few: the mouth mirror,
All right.
the anesthetic which you'll use, your dental syringe, your dental drill, your spoon
Mm-hmm.
excavator, your scaler. This seems like wow. It's all kind of a different tools that you have, right? How do you work with all these special tools or
Mm-hmm.
equipment that in a tight space, like literally, like like the kind of
Yeah,
stretch?
it is like that initially.
Yeah.
It takes practice, but in the long run, you actually start feeling like, oh, that's enough space. Even if like
Right.
for other people, they feel like, oh my god, such a small space. How are you
Yeah.
gonna stitch this up? How are you gonna close it up? How is the hand drill gonna go in? Is there
Right.
enough space? But actually, with practice, it becomes easier. So we are trained to maneuver dental treatments procedures in small tiny
Right.
enclosed spaces, yeah. So I think practice makes perfect kind of a thing.
With a needle, with a what do they call it, thread, I will find very difficult, even though there's so much of space. But you are working, I mean, most dentists, I mean, every dentist is working in a very tight space. I
Yeah.
mean, it's, I think, the years and years of experiences or training that gathered
Mhm.
where you are right now. Thank you, doctor, for that. We are going to go a little bit more deeper in as well. I mean, we're still talking about the teeth, the tooth.
Mhm.
How losing your teeth can affect your appearance. And we
Yeah.
spoke about this. I think your jaw or something like that. Your face structure
Yes,
changes.
yes, yes, it does.
Right.
So basically, what happens is like, all right, like we're talking about how dental health affects your mental health, right? So we are talking about your appearance, all right?
Yeah.
Your appearance, I mean, people say like, oh, do not judge a book by its cover, but that's what everyone is doing anyway. So
Yeah.
your
Yeah.
appearance is actually very important, and how you look is how you feel, right? And that is going to give you confidence. So for instance, let's say, what are the common problems that people face, cosmetic issues in dentistry? Of course, one is missing teeth. Okay, missing teeth, why that happens? Okay, probably because of an extraction or trauma, an accident case, they lose their teeth, or due to poor oral hygiene or some gum related diseases or tooth decay, their teeth had to be extracted out. So what happens, we talk about the extraction part first. All
Right.
right, when you lose a teeth, all right, it actually changes the shape of your face, the dimension of your face, and how you look in the long run. Because when you actually lose a teeth, right, you are actually reducing the space. All right, you're actually reducing the space between your nose and your chin. All right, so the space gets lesser and lesser. So you can actually notice in like older people, like our grandmothers, our grandfathers, and
Mhm.
things like that. They have this very collapsed look, very hollow look. All right, and eventually your lips become thinner. All right, you do not have this full appearance. All right, so your teeth is actually important in maintaining, giving you this very full appearance, actually in keeping you looking younger as well. Because if you lose your teeth, like I said, the we call this the vertical dimension. All right, the space between the tip of your nose and the chin, it becomes smaller. All right, when it becomes smaller, your facial height, that means your lower facial height, is going to be reduced. All right, so like you're losing volume in your face,
Right.
so that's going to make you appear older. That's one thing. And another thing is, okay, extractions. That's how it affects the structure of your face, all right, in the long term. And extractions, okay, missing tooth, especially in the anterior teeth. All right, if you have a missing tooth in the anterior teeth, of course anybody is going to feel shy to smile, because the gap is very obvious and very prevalent. So much so, like, I have personally encountered a lot of patients, especially females. They are extremely shy. They start shying away from social events. They don't want to go to work. They're like,
Hmm.
doctor, please, can you get me the dentures immediately today? I need it. And it's very pitiful, because we understand, how they would feel, because it's affecting how they look, and it's also affecting their speech, especially if they are
Yep.
teachers or they're lecturers, they are speakers, where, or they're doing business, where it involves talking to their clients. It's
Mhm.
going to affect their business as well, if they can't pronounce certain things, if they're already going to feel low, have very low self-esteem. So we dentists, we are very, very how do you say, we have all kinds of treatments, and we
Right.
can do the best for our patients. So if they need a denture immediately on that day, we can always work it out. So that part is, if I go into that part now, we're going to dive into like a whole variation of treatment
We have to
options.
do a series, I guess. Series 1 to
Yeah,
series 10.
there's too many things to talk about dentistry. Yeah, so I understand, like losing your front tooth, especially, is going to affect your confidence. You'll start
Yep.
shying
Yep.
away from social events. It's eventually going to make you feel less confident, have lower self esteem. And in the long run, you're actually going to have social anxiety. All right. And you're going to be very self conscious about everything that's happening around you. And like when you're actually very self conscious about yourself, like
Yep.
other people, they can notice that you're actually very uncomfortable. Even eating, going out and eating with your friends, you're going to be so conscious. Oh, they are watching
Mhm.
me eat, like, because these are things that I've picked up. My patients have opened up to me. All right. And yeah, so all these kind of things is going to affect them in the long run. It's going to cause even depression as well.
But like that's why I think we are coming right now. We are
Yeah.
putting the dots backwards or front. We can say whatever we want to. But I think we mentioned about mental health versus, I
Mhm.
mean, not say versus, mental health and dental health
Dental
plays a
health,
part.
yes.
Is it also because the confidence going down, right? I mean,
Yeah.
it seems like whole, you got anxiety, you got probably anxious, you're not sure
Yes.
what's going to happen or what going to people say, the judgmental is going on. So is it also another reason why people are feeling stressed and that leads to mental issues to
Health,
come by?
yes.
Yeah.
Yes, it does. Just self-confidence. Once your self-confidence is down, you're
Yeah.
constantly going to be overthinking when you're out in a social setting,
Yeah.
right? Overthinking is definitely not
Hmm.
good, although we do
Hmm.
it to a certain extent, everyone. But
Yeah.
when it comes to your appearance,
Yeah.
it's really not. It's not really a very nice feeling.
But doc, I'm going to ask you something, right? And I know we are saying that losing your teeth can affect your appearance, but losing the wisdom tooth, are we becoming lesser wisdom or
Less
keeping
wiser? No, you do
it?
not become less
Yeah,
wise by losing your wisdom.
when I want to pull my wisdom, I was asking my dentist, "Do I have to do?" He said, "Yes, I have to do." So he was
Yeah.
doing all the prayers before you doing. I'm like, "Oh my god, you are really praying!" But that's a procedure that he does. But he feels so much better, right? The pain has went off, and I can imagine. I will just prolong it. Say, never mind, next month. Then next month, pain comes. Then we react. But then I think sometimes it's become too late. Then you become swell. You got headache.
Yes.
You feel migraine. You feel everything. You don't want to wish
You
upon
you
everything comes.
definitely have dental anxiety.
But
Postponing your
nowadays,
appointments till the last minute, till it's an emergency situation. So that is one of
yeah,
the clear
yeah,
signs
yeah,
a
correct.
patient has dental
Yeah.
anxiety. Yeah.
For me, I think it's fine. That one part they put the polish, like, the whole head. Feel like they say it's some kind of a sensation is because of the hearing. It's like, what's happening
Mhm.
inside the mouth? Oh,
Yeah,
but at
and
the end of the day,
yeah,
feel good, right? You feel good.
true, true, true.
All right, Doc. So we are going to go into the next one. So wisdom tooth is a compulsory. We have to extract it out. Am I right to say that?
Yes, okay. So wisdom tooth, all right. There are different school of thoughts actually. I believe in prophylactic removal of your wisdom tooth. So basically, your wisdom tooth, most people, all right, not all their wisdom tooth, their lower wisdom tooth, all right, erupts in a straight way, all right. Most of the time, it does not, is not able to erupt completely, which is why we
Mhm.
call it impacted, all right.
Yeah.
So basically, your wisdom tooth is your third molar, all right.
Okay.
So we have two molars in our dentition, all right, which is your
Mhm.
first molar and your second molar. And right at the backmost part, all right, that's your third molar. All right. So usually your third molar, it does not erupt straight. Some people are lucky, yes, it erupts straight and they have functional occlusion. When we say
Right.
functional occlusion, it means their upper third molar is also erupted and is in good contact. All right, they're able to grind food and
Yeah.
chew food and everything. But usually these third molars, especially the upper ones, are extremely difficult to keep it clean. Even I had mine removed. I've already had three of my wisdom teeth removed when I was in
Mhm. Wow.
Sarawak, yes, because I know that in the long run it's going to become cavitated and it's actually going to cause a cavity to the tooth next to it because food is all going to get lodged in between because like I said, it's not going to be erupted straight. It's going to be erupted in a slanting way. All right. So food is going to get trapped in between and it's going to be very, very hard to keep it clean.
Right.
All right. So I would suggest prophylactic removal. The moment you have your first sign of pain or discomfort, please go and visit your dentist, get an x-ray done. All right. Get an x-ray done. And because sometimes you can't really see the cavity extraorally through physical
Mm.
examination. So when you get an x-ray done, you can actually see if there's actually a cavity there or not. What's the extent of the cavity? If the cavity has already affected the adjacent tooth, if the
Yeah.
adjacent teeth can be saved or
Right.
both teeth has to go. Yeah, but usually if it's at the initial stages, then usually you're pretty safe. Just get your wisdom tooth extracted. And not all wisdom tooth requires surgery. Only
Mhm.
those that is unable to be removed, they don't have a clear exit pathway,
Mhm.
then we have to do a minor oral surgery, which is
Mm.
actually pretty comfortable. It's not very scary. It's not scary. We'll give you like complete anesthesia. You'll be very comfortable throughout the procedure.
Right.
Just when you go back home, you have to follow your post-op instructions. Yeah.
Okay, disclaimer. I got to say this right now. I'm sure everybody's hearing this is going to go to the podcast. It's going virtual. I mean, virtual, viral everywhere, right? I was actually a dentist when I was young, right? Trust me, right? I was a dentist. My uncle, or in my family, or my big family, all right. Whenever anybody have a loose tooth, just like a wave, left, right,
Uh-huh.
up, they will call me because
Okay.
I always go with the thread. I'll just put
Okay.
behind the thread one, two, three, pop. And I've done
Oh,
that for my uncle. But I know that can be very dangerous, isn't it? I mean, because, there's so much of nerves inside that can go wrong. Or what can go wrong on that, doc?
how old was your uncle when you did this?
I think he was about 50s, 60s.
All right. So it was definitely a permanent tooth. So
Yeah.
Must have been a really mobile tooth for you to be able to actually remove it with your needle. Yes, I mean your string.
Yeah.
Yes, but are you sure you completely removed it, or you just removed,
Okay.
the top
It's
part that is damaged?
definitely no PPE. There's no equipment examination equipment set and nothing on that. Only the thread. Only the
Okay.
string. Sorry, thin string. That's it. Gone.
That's it, thin string.
Yeah.
Okay, so
Yeah.
a lot of coming back to my experience, a lot of patients they're like, oh doktor, saya sudah cabut gigi, yang ni sudah
Uh,
cabut gigi, hari ni saya nak cabut kat sini. So like they're like telling like, oh doctor, I actually this tooth I already extracted it. Now I'm having pain here. Can you please extract the tooth on this side? Then when I do my dental examination, I'm like, no, your tooth is still there. They're like, no, 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 I actually already removed my tooth, And I'm like, no, you have not. I think you actually just removed the crown part, all right? So the crown part is actually the top part of the tooth, but you have not actually removed the roots, all right? The legs, okay, the roots. All
mm,
right, you have not removed the roots. So a lot of them think they extracted the tooth by themselves, but actually they've not. The roots are still left retained, and it can actually cause an infection later on. Yes, so please don't use the string anymore.
no more. No more
No more,
string ready. Yeah.
no more
They
string.
don't,
Okay, yeah,
they don't believe my expertise anymore for using that
yeah,
string to
yeah.
extract the
So
food out.
yeah,
But
so
it can
most
be
of the
very
time,
dangerous. Yeah.
yeah, it is dangerous as well, and you never know. There can be like cross infection and
Yeah.
things like that.
All right, doctor. Thank you for that. For all the viewers who are just giving us a lot of comments, thank you so much. I'm definitely going to display that. We are also going to answer those questions. Please do not go anywhere. Tavania. We also have Tamare. Thank you so much, Vimal, Dr. Ramithaa. So there's a lot of messages coming. Keep them coming in because the last 50 minutes of the show, we are going to take it for the Q&A for Dr. Ramithaa Venu. Is going to talk about everything about dental. Probably we're going to go a little bit on the mental health as well. You're going to
All
come
right.
in. Thank you, Shiva, for that particular, what is that called? Comment. And of course, Tamare has already asked us how dangerous is the effect of the dental to mental. We are going to answer that in the last 15 minutes of our time. We have a certain more segments to go by.
Mhm.
So yes, so now we are coming in, dentists. Some say 6 months, some say 3 months, some say once a year, some say never mind, decade, one time.
Oh God.
No,
All right.
so I do not know what kind of how bad can he be, but what is this? 6 months is good enough or 3 months?
All right. For patients, all right, who have underlying medical problems, like they've got like they've undergone like chemotherapy, radiotherapy, all right, at the initial stages, all right, or they have got like chronic heart disease, chronic kidney diseases, just generally very serious comorbids, we call it, or serious health problems. We would suggest for them to come every 3 months once, at least at the initial stage, especially when they have changed their dentist or changed their location. All right, 3 months once. So why we do it every 3 months once? Because you see, all these patients they take different types of medications. All right, and medications can actually affect your oral health as well. All right, like certain medications, especially for hypertension, it can cause something called as gingival hyperplasia. Okay, gingival hyperplasia is basically the enlargement of your gums. All right, generalized enlargement of your gums. So when you actually have that problem, there would be difficulties in keeping your teeth clean. Food gets impacted easily. Your gums will be really inflamed. It'll be really painful and swollen, bleeding gums and things like that. So, which is why every 3 months once we call them, all right, to get a review of what's actually happening, all right, with their medical health. Is there any changes in their medication? All right. What is their next course of treatment for their medical well-being as well? All right, and of course we will go with the routine dental checkup, to
Right.
see, are their fillings all still intact? Do they have any cavities, new cavities? Because we'll have their records, we have to upkeep with their records.
Mhm.
And so a review of them. Patients with serious health conditions, they were required to come at least every 3 months once. And of course we will slowly reduce the duration of visits
Mhm.
as we see fit. All right. From 3 months, maybe it'll become 4 months, and then slowly 6 months, then eight, then maybe once a year, depending on the oral health condition of the patient. Yes. And generally, for normal, fit, and healthy people, I would suggest 6 months once. All right. Six
Okay,
months
6 months
once.
once. Yeah.
Yes. All right. 6 months once is very important. even if you really can't, you're like really busy, like maybe you're like offshore, you hardly come back, and things like that, at least once a year you really need to get a full and thorough dental examination done with dental x-rays. All right, because sometimes a lot of cavities, you can't really see them, all right, because they are in between the teeth. All right, we call them interproximal caries. They are in between the teeth. We cannot be seen by clinical examination. So it's best to take an X-ray at least once a year to see, if there are any hidden caries, hidden cavities, and we can
Right.
actually get to them before it's too late. Before the cavity actually reaches the nerve and causes pain,
Mhm.
infection, swelling, and things like that.
Right.
So 6 months once is very important. Yeah.
Right. So, for all the viewers, I can see more messages are coming in. Thank you so much. We are going to take that all in the last 15 minutes. I know. I think we are going to extend our show by another 2 hours, Dr.
What?
Ramitha. Yeah, yeah, yeah. So for you, no dinner, only brushing teeth later because so many questions coming in. Okay. That was on the lighter side. But on a serious note, I also heard about these two things that you use. I mean, most dentists use
Mhm.
Explorer
All
and
right.
pliers. Pliers.
Ah, yes.
Pliers. Do you use pliers?
No, we don't
No.
use
Okay.
pliers.
Okay.
No,
All right. So
we use
Explorer.
dental
What is
forceps. Yeah.
okay? The forceps. So what is the Explorer means?
All right. So the Explorer is basically, if I knew you were going to ask this question, I would have brought an example.
Ah, ha, ha,
So,
okay. But I know
all right. So
you brought something,
I,
right? The
I brought only the tooth model.
oh, okay. That's a perfect one, huh?
Yeah, it's a perfect one.
Okay.
All right.
Yeah.
So, and Dental Explorer, all right,
Yeah.
basically, we use it. It has a sharp tip, but not too
Okay.
sharp. It's slightly blunt. All right. So, what we use the Dental Explorer for, all right? So, we actually run it on the surface of your teeth, all right, to see if there's any cavitation. So, we run it, and we have to put like very light pressure and run it. And if we feel a catch suddenly, it's running
Mm,
smoothly, and suddenly we feel a catch, it means there's a cavity there. So that is what we use the Dental Explorer for. We also call it a
right.
dental probe. Yeah.
No
It's
pliers,
it,
huh?
no, we don't use pliers, no.
Okay. So it's a forceps.
But we have an instrument called cryers, but not
Okay.
pliers. Yeah.
Wow. So you must be like a what shall I don't know, because so many, things, it's a bit, I mean, not say scary. That was like 30 years back when I
Mm-hmm.
was in the lower student, I was always scared of dentists. Now I don't scare. You see, I can talk to you now. You see
Yes.
how brave I am. I'm sure everybody is out there, viewers especially. I think it's very important to check with the dentist at least 6 months once. That's what Dr. Ramitha Venu has recommended and suggested as well. We got one more question to take on, Doc, before we jump into the Q&A time.
All right,
We talked
sure.
about anxiety. We talk about phobia, right?
Yes.
The consequences of dental fear.
All right.
Someone like me, the younger days, probably you will never be able to convince me because
Yes.
I run 100 meters away. I won't even turn up.
Yes. Yes.
But is it quite common only in the adolescence age, or is it on the adults or the elderly as well?
Okay, so dental phobia, dental anxiety, actually we see it in all age groups.
Right.
All age groups, all right. So let's go to the causes of actually dental fear. Like why is actually, like, a person is so scared of the dentist. Like, I can tell you in my experience, like in a day, if let's say I have maybe 10 patients, at least 3 to 4 of them, the moment they step in, like, oh doctor, saya sangat takut tau dengan doktor gigi, and like it does hurt us a little bit, but it's our responsibility. Okay, like when it comes to managing patients with dental fear or dental anxiety, it's entirely up to the dentist, I would say, to
Right.
manage the patients. All right. So we have to talk to the patients, we have to make them feel comfortable, and sometimes they actually really open up like what happened and why it happened. So most of it is actually stemmed from a very bad experience that they had previously, maybe as a
Mhm.
child, and they are hearing all kind of weird dental stories, horror stories, and things like that. And maybe they have experienced abuse as well, because patients or people who have experienced abuse, they have this phobia with people in authority. All right, because you
Mhm.
see, when they are lying down on the chair, our patients have no control of what's happening, right? So, and they don't know what's happening. So it instills more fear in them. So,
Mhm.
um, certain cases, yes, it's due to a history of abuse as well. All right. And another aspect is also they learn through behavioral patterns. All right, so there are a lot of cases, even I've seen it, the child comes in as a kid,
Mhm.
she's already having a toothache, and the mom or the parents, parents or the guardian will be like, sekarang ni doktor cabut gigi kau, tahulah kan, tak nak berus gigi, they just add on to the fear, and I'm like, please don't do that, like,
Yeah,
and the
yeah,
child
yeah.
starts, crying and
Mhm.
wailing, and you have to like comfort the child.
Mhm.
This happens even in adults, in older people as well, so I
Right.
think it's very important to tackle the root
Yeah.
cause of it, all right, before we can actually treat the patients, like especially for children, all right. If it's their first dental visit, we try not to do any extensive treatments. We try
Mhm.
to desensitize them. So first we have to talk to the child, 5-year-old style, and get them to be comfortable with you,
Mhm.
and then slowly introduce the instruments to them. It's something we commonly practice in dentistry. It's called the tell, show, and do technique. So we introduce each equipment. I'll be like, okay, so this is a mouth mirror. I'll let them hold it. I say, can you see yourself with the mouth mirror? You see, it's not
Mhm.
sharp, right? And actually allow them to hold it and to put it in their own mouth. So, they kind of get used to it, So slowly with each step and each visit, which is why, especially for children, it's very important for the parents to make sure that they bring their child for their follow-up appointments. There's a
Mhm.
reason why we give an appointment, is so that we can continue the desensitizing phase for the child, and the
Right.
child will actually eventually become an extremely compliant adult as they're
All right.
growing up. 6 months once, sometimes they will just come 3 months once, and they'll be more aware of their dental health, like little bit sensitivity, they will immediately come, and things like
Mhm.
that. So now we go to
Right.
the consequences of untreated dental phobia or dental
Yeah.
anxiety. So basically what happens is, like, this untreated dental phobia, dental anxiety, these people, they are just truly, truly scared. They are like intelligent and rational people. They are
Right.
able to think what is right and wrong. But because of that fear, they actually push they push all their appointments, or they would just cancel last minute because they're so frightful
Phobia.
of the dentist. Yeah,
That's
just
right.
like you mentioned earlier, your
Yeah, I
wisdom
can,
tooth
I can, I
story.
can relate to that to you. Never
Yeah,
turn up.
yeah, they'll just like never turn up, and there's nothing we can do if the patient doesn't turn up.
Yeah. Yeah.
So the consequence of dental fear is they will turn up eventually when things go out of hand, when it's an emergency situation. The
Right.
dental infection, from an abscess, has already become a cellulitis. Like the abscess is
Wow.
all over the facial surface, all facial spaces of your face. All right. And it's an emergency situation. We have to push him into the operation
Right.
theater. It's going
Right.
to add on more to the fear, actually. So it's
Right.
actually a very vicious cycle,
Hmm.
like coming in at the last minute, and we have to carry out extreme procedures, extensive procedures. Instead of them, can you imagine, you just come, okay, like 6 months once, all right? We can check, we can prevent, we can do preventative dentistry. And if you maintain your oral health very well, all right, that would also help.
Perfect, doctor. I mean, you should have been my dentist when I was young.
It's not too
But
late.
not too late, not too late. But I just that I got to come all the way there. But why not, right? I'm going to take a few of the questions right now. Thank you, viewers, for all the messages. I mean, I quite lost here because there are too many messages that came in. So Vimal, I think Vimal Venu has also asked us, if I lose my tooth, will it affect my face structure? I think we have talked about it. Maybe you want
Yes, it
to,
will.
yeah. Any
All
chance
right.
he's your brother? No, right?
Yeah, he's my brother.
Okay, so I see my instinct is correct. Yeah,
Yeah,
thank
but
you, Mr.
I've
Vimal.
actually told him about it before. But yes,
So he's
it will.
joining to support. Thank you,
Yes,
Mr. Vimal Venu, for joining Ramithaa Venu here. So
yes,
yeah, so you mentioned is it will affect the face structure, right?
yes. In the long run, it's going to affect the structure of your
Right.
face. Okay, so like I mentioned, okay, so I'm just going to use a tooth model since it's already here. All
Please,
right.
yeah.
So so right now, can you
Okay.
see the
Yes.
dimension? All right.
Yeah.
It's basically this length. Okay, I don't have a
Hmm.
measuring tape, so it's
Okay.
about this high, right? So imagine if you actually start losing your back teeth. back teeth, front teeth, whatever, okay, whichever teeth, all right. Your facial height, this height, all right, from this point to this point, it's going to reduce. So from this height, your
Mhm.
facial height, all right, is going to reduce to this. And slowly,
Oh,
as you keep losing more teeth, it's going to reduce. It's called resorption of the bone. All right, your bony structures is going to resorb eventually over the years,
right,
especially, and it will be accelerated with tooth loss. All
right.
right. So eventually, like I said, your facial height over here, your lower facial height, we call it, is going to be collapsed. Like right now, you see my facial height is like from here to here, right? All
Mm-hmm.
right. My face looks full. All right. There's no collapsed look, nothing. It's from here to here, right?
Right.
All right. So can you imagine if I start losing teeth? All right. Because there is no hindrance. All right. Because when there's teeth, right, there's a hindrance stopping it from
Mm,
going below, right? Imagine
right.
I lose my bottom teeth now. So now it's only the gum here. Before this, my lower teeth was here, right? I lose this teeth is out.
Right.
So
Right.
now
Right.
this tooth is going to be collapsed downwards. It's going to go downwards. My facial height from here is going to go down.
Nah.
Yeah. So it's going to go down. So I'm going to have my upper lip is going to become thinner. My cheeks is going to collapse inwards. I'll have this very hollow looking appearance. And
Mm.
yeah, it's also going to contribute to a lot of wrinkling around your lip. And sometimes some of them would experience drooling of saliva at the corner of their mouth, which can lead to something known as angular cheilitis as well. Yeah.
All right, doctor.
So that
That
is how
sounds a
it
little
affects.
scary story, but I mean, these are the true fact.
Yeah.
What will happen if not being taken care, right? I mean, if
Yes.
you don't put a seed now, you will not be able to get the tree to bear the fruits over there. So it's like taking
Yes.
care, taking care. That's what Ramithaa Venu is talking about. Yeah.
Yes.
We have another question here by Tamare. Thank you, Tamare, for that particular question. If we lose the teeth by extraction, are we advisable to do gum or teeth replacement?
Yes, most definitely. Because actually, when you do teeth replacement, when you extract the teeth, we would
Right.
have to replace the space, all right? We have to replace the tooth that has been lost. So there are different treatment options, especially now. We have varying from dentures, we have implants, we've got bridges, and many other more treatments. Even in dentures, we've got different types of materials and things like that. So why is it that we need to replace this teeth? All right. So like I mentioned, the facial height, right? So after an extraction, you got to wait, all right, about 4 to 8 weeks, depending. Some people might take even longer, about 3 to 6 months for complete healing of the socket. All right, but usually after 1.5 months you can come back. All right, we'll take an impression of your jaw. All right, and we talk about dentures first. Okay, so we can
Right.
actually replace the teeth. All right, the space. All right, let's say this tooth is missing, this tooth is missing, it's not there now, right? So we would take an impression and we would put the artificial tooth on, and now your facial height is restored. So you have to get the space covered up by an artificial tooth, because another thing is going to happen. If the space is going to be there in the long term, the other teeth is going to be like, hey, there's an empty space here, let's move here. And they're going to start crowding, they're going to start moving around. And it's going to affect
Right.
your midline, which is the central line of your face. It's going to affect your midline. It's going to affect your overall outlook. Your teeth is going to start shifting here and there. And it can actually cause a lot of other issues as well.
Mm. All right. Uh, that's a great one there, Doc. I mean, for that answering that for Tamare, I'm going to pull up another one coming up as well. We talked about okay. So this Janita is how to take care when the crown fitted on your tooth.
All right. How to take care of the crown? When you have a
Yeah,
crown, all right, you have to
yeah,
visit the dentist. At least, would suggest if it's new, you're new to it, and your oral hygiene is moderate to fair. I would suggest at least 6 months once. If you can come more often, that is good, because we need to check the gum health, the margin surrounding the crown, whether it's intact, if the crown is cemented properly, because sometimes in the long run, your crown can actually, certain cases, not all, can actually become loose and it can be dislodged. So we want to check the integrity of the crown and the integrity of the surrounding tissues, all right, to check the health of the surrounding tissues. So 6 months once, we would suggest for you to come in to check your crown and also to check your gums, all right, because your crown is basically cap onto your tooth, and your tooth is going to be surrounded by your gums. So we would not want there to be any kind of plaque deposits or calculus deposits around there, because it's going to cause some sort of gum infection over there,
Right.
and eventually, if you don't take care of it, your tooth can become loose. Yeah. So 6 months
Thank.
once, and brushing, proper brushing, of course. Flossing is extremely important, extremely important. A lot of people overlook that. Flossing is very important, at least once a day. All right. I can see that you don't floss with Vans.
No, I was just literally adjusting my. Okay. Yeah. All
Yeah.
right.
So
Okay.
flossing is very important, especially if you have crowns or even bridges. Bridges, you have to use something called super floss. I think
Okay.
we'll have to do a separate segment on that.
All right.
So yeah, flossing, your general how to maintain your health is, one is of course flossing, brushing, all right, using a mouthwash, and also visiting your dentist, for oral prophylaxis, for your
Right.
checkup, like I say, 6 months once, or even more frequent if possible. Yeah.
Right. Thank you, Doctor. Thank you, Dr. Ramithaa Venu, and all the viewers watching right now. Thank you so much for all the messages that's coming in. We are going to make Dr. Ramithaa Venu tired. Probably she'll be thirsty right now answering all those questions, but she's still motivated. If you're watching this, please do share and like so that it can reach out to many more of your friends and families who may need help or who may just need this piece of information to see their dentist. And here with me is the lovely Dr. Ramithaa Venu. We also have, well, it seems like your brother is a very big supporter of you. Have you done any dental checkup? Maybe this
Yes,
time
I have. I have.
you've done. Okay, good. He's asking about dental ache, painkillers. Will that work?
Yes, it will. But it's
Temporary.
just for symptomatic relief, but
Okay,
it is not the solution.
right.
So if, let's say, suddenly middle of the night you're waking up with a
Pain.
dental pain, then
Mhm.
yeah, of course, you can't be sleeping throughout with the pain. Of course, please go
Right,
ahead if
right.
you have, like, your Panadols or
Yeah,
your Constants or any painkillers, analgesics that you
right.
are comfortable taking with no allergy
Mm,
reaction, please go ahead
right,
and take it. But the next morning, please go and visit your dentist and figure out
right.
why do you have the pain. Yeah.
Okay, disclaimer again, if you want a certified real experience, please go to Dr. Ramithaa Venu. If you just somebody to pull, with a piece of string or thread, come and see me. Like, of course, definitely not a ideal, not recommended at all to do it. Like we just talked about it, so much of infections, so many things can go wrong at so many different levels. Thank you, Venu, for that particular question. We are going to take in more. Say that true. I love going to the dentist. Can't take the pain when you get toothache, but you see, that's a problem, right? The body is always communicating with us. We don't listen to the body. We are just too stubborn. Never mind. Tomorrow can settle. Never mind. But then when the thing gives you a lot of pain and swelling, do you think it is the time to come and see you or see a dentist?
Yes.
Yeah.
Yes. There's never a wrong time to see a dentist. It's always the right time.
Right. Okay. Thank you for that. So we have Tavania here. Tavania said, I'm fearful of deep cleaning. Tavania, why are you scared of deep cleaning? The injection, I'm constantly not going forward with it. So we got a
Okay.
phobia here. She's a very good
Yeah.
friend of mine as well, Tavania.
All right. Hi, Tavanya. I'm so sorry to hear that you're really scared. All right. So, I think you just need to communicate with your dentist about how you're feeling, why you have the fear, and open up to your dentist. And I'm sure they can come up with the best treatment for you. Right. Actually, deep scaling and dental injections. A lot of people have this fear of needles. I wouldn't lie, even I am scared of needles. Like when I had to get my COVID shot, I was freaking out. But
Oh,
the fact is, I give injections every day to
every day.
everyone else. But when it
Yeah.
comes to me, I'm like, oh my god, the needle is there. Ramitha, don't look, turn away. You know, it's that kind of thing. Like
Right.
everyone has fear of needles. Most people.
Hmm.
All right. So I think the key idea in overcoming that fear is, of course, by
Hmm.
communicating it with your dentist. Like I said, when it comes to handling dental phobia, all right, 90% of the management and the responsibility goes to the dentist, all right, to
Right.
manage the patient. All the patient has to do is you just show up to the dentist, make sure you're comfortable with the dentist, and you trust the dentist. To have trust and confidence in your dentist is extremely important, all right. And because I understand that, like if you don't trust your dentist, you can't see what's going on, and you don't even
Yeah.
know,
Yeah.
like what is actually going on. You can't see what the dentist is doing. So to develop the trust and the confidence in your dentist is
Right.
very important.
Yeah.
So Lavanya, I hope you can communicate with your dentist, and let him or her know that why you're having the fear, what caused the fear. Like I said, like managing dental phobia, dental anxiety, getting to the root cause. I think maybe you had a bad experience previously. So I hope you can find a solution out of it, and get your scaling done. All right. Don't worry, scaling is not scary. It's usually people get scared by the noise of the scaler tip. Yeah. That
I can, I can,
high.
I can make the noise.
Go ahead. Yeah. It's exactly like that. Yeah. Even sometimes I get a little.
Yeah, but sounds like a mosquito. But that is how it's like. It's a kind of a
Yeah.
music that you don't want to hear. But can we wear earbuds or some listen to music? That's fine.
Yeah, we can. We do provide that.
Oh, okay. So next time we can just wear some earbuds, some nice rock and roll, some
We wouldn't
Guns N'
suggest
Roses.
music, but maybe just
Okay.
earplugs. Yeah.
All right. All right. Thank you for that. Thank you, Tavania. Thank you, Dr. Ramithaa Venu. We have a member here who have asked us, Mohammad Isham Mudin. So how mine? Your question have to be a little bit more specific, buddy. So how might we know what is the thing? It's a good friend of mine as well. Calvin is here. Calvin, thank you so much for the question. Is there age limitations on when you can do extractions or replacement?
No, there's no age limitation at all.
All right, Calvin, you heard that. Thank you, buddy, for that. I've got two more questions here before we can wrap up this. Do we still can
Please.
do a teeth replacement after 3 years due to COVID, unable to get doctor's appointment?
Yeah, a lot of people are facing this problem. During COVID, very hard to get dental appointments, and the SOPs became tighter. So, yes, definitely. Like I said, there's never a wrong time to go and see a dentist. It's always the right time to go and see your dentist. But after 3 years, probably, if you extracted your teeth 3 years ago, probably, I'm not sure if the space would still be there. I hope the space is still there for you to get your tooth replaced, but I'm sure your dentist can offer you the best treatment. So please don't wait any longer, and try to get an appointment with your dentist as soon as possible.
Thank you. Thank you for that. Thank you, Tamari, for that particular question. We have lots of loving messages coming in. Thank you so much for the information, Dr. Ramita Reno. No,
Um,
Reno. It's Venu. It's okay. Typo. We can change that. We also have a lot of messages that's coming in, but I think I'm going to take this from Shalini
okay.
Mohana Kumaran. What is your take on teeth whitening, which is the now, or is it advisable?
All right. Let's talk about teeth whitening.
Yeah.
Okay. Open the
Yeah.
whole other can of worms now.
Okay. Okay.
Okay, so my take on teeth whitening. All right, so coming again to the topic of appearance. All right, cosmetic dentistry. Okay, whitening comes the initial part of of cosmetic dentistry. All
Yeah.
right, so usually there's this a huge. I'll just go about the huge misconception about whitening. So some
Mhm.
people have this huge misconception and misinformation. All right,
Yeah.
about professional. I'm talking about professional dental whitening, which is done and provided by a dentist. All right,
Mhm.
not the ones that you buy on Shopee or Lazada or charcoal toothpaste. No, I'm
Mhm.
talking about a professional dental whitening provided by a dentist. All right. So a lot of people think that the bleaching agent which we use, all right, the chemical which we use to whiten the teeth is actually going to erode your teeth, and it's going to strip off a layer of your tooth. Did you think the same as well?
Um, I mean, I'm sure the medical science is always coming up with new technologies, new
Yeah,
inventions. Probably, if it is not prescribed by a doctor, it's
yeah. No.
definitely not recommended at all.
Yeah. So the misconception that they have is they think that the products we are going to use, all right, the whitening agent we are going to use is going to erode the teeth, is going to strip off a layer of the teeth. All right. So that is completely false. That is completely false. It's a misinformation. All
Yeah.
right. I hope after this session, I would have shed some light on how actually professional dental whitening works. Okay, so the first step, all right, we use the chemical that we use is hydrogen peroxide. All right, so there are different forms of this hydrogen peroxide. All right, different concentrations and things like that. So how we start off the procedure is we would actually use it alongside with the LED light. All right. So we would actually apply the chemical. We'll apply this thing called the gingival barrier, because sometimes this hydrogen peroxide is, the concentration is very high. It can actually, how to say, it can cause some irritation to your gums. So we'll apply a gingival barrier. We'll make sure before that your teeth is already scaled and polished prior.
Yeah.
All right. Probably in a different seating. So you come back like after a few days for your whitening. All right, we'll apply the gingival barrier, then we would apply the bleaching agent. So how does this
Right.
bleaching agent work? Okay, it's not going to strip off any layers of your tooth. It's not going to erode your teeth. Your teeth is not going to become thinner. So just like our skin, right? Our skin, we have pores, right? So our teeth also have pores, all right, which we call tubules. Tubules. Instead of pores, we call them dental tubules. All right, dentinal tubules. So our teeth has three layers. Okay, the first layer is your enamel, which is the outer part. The second layer is your dentine. All right, your dentine, and your third layer is your pulp. So remember dentine, your second layer. This is the important part. All right, so your dentine, all right, is the one that actually gives color to your teeth. All right, and it's more yellowish in color than your enamel. All right, so what does the whitening agent do, or the bleaching agent does, is when you apply it, it's actually going to open up your tubules. It's going to open up your tubules, all right, and it's going to allow the bleaching agent to penetrate through the tubules and bleach the second layer, which is your dentine. All right, and we would then activate it with the LED light or the UV light, depending on which system we are using. Most of the time it's an
Right.
LED light, right? And we can go up to 3 cycles depending on the system. We have different systems, whitening systems. All right, so we would advise whitening for patients who are extremely concerned about their appearance. All right, and like I said, if you really feel your teeth looks too yellowish and you want whiter teeth, then yes, by all means you can do dental whitening, professional dental
Mhm.
whitening. But there are a lot of restrictions, dietary restrictions that follows.
Right.
You can't have your curry, all right, you can't have coffee, you can't have your tea, you can't have wine, anything that can possibly stain your teeth.
So
And we would suggest,
basically, just water.
yeah, just
Okay.
water.
All right.
Or you can actually have coffee, maybe just drink with a straw, like directly into your throat.
Ah. Okay. Okay. Right.
So
Right.
that's
Right.
like one tip, you know. I have done whitening before, so
Okay.
but my love for coffee was more than the effects of the whitening.
Mm.
So yeah, and
All right.
another thing you need to understand is after your whitening, there will be a period of time, maybe 24 hours to 48 hours, sometimes even longer, that you would experience sensitivity. All right, so why we say sensitivity? Because once the whitening treatment is completed, your dentinal tubules are still open. All right, so there is direct access to your dentine. All right, so you're going to feel sensitive. It's going to take time for your dentinal tubules to shrink back and to close back. Yeah, so you would have this dentinal sensitivity for about 2 to 3 days, or sometimes
Mhm.
just even one day or a few hours. It depends. It really
Right.
depends on the person. It differs from one person to one person, which is also why we say, please avoid coffee, tea, anything like even mustard, anything that can stain your teeth, like for at
Mhm.
least the first 3 to 4 days, because the
Okay.
tubules are really open. So there's going to be
Mhm.
like direct access to stain your teeth as well.
Doctor, I always like to think out of the box, not inside the box. Sometimes
Okay.
outer the box.
Okay.
How about just brushing for 30 minutes? Just brush, 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 brush. Put Colgate or put the paste, brush. Can it whiten as well?
No, it's not going to whiten your teeth. It's going to remove extrinsic stains. And if
All right.
you overdo that brushing, brushing, brushing,
The
it's also
gums.
going to wear off your tooth. Yes, it's going to wear off your tooth, especially if you brush very forcefully with a
Yeah.
hard bristle toothbrush. Then yes, it's
Right.
going to wear off your tooth. And if it
Okay.
wears off your tooth, your enamel surface is going to get stripped off, and your teeth is going to appear even more yellowish actually.
Right. So many
Yeah.
procedures, so many things to taken care of. Any side effects on the whitening? Because that's where our final
Mm.
question for the
Yes.
day, my
Side
tamarind.
effects of after teeth whitening, of course, like I said,
Yeah.
sensitivity. All right, you'll have sensitivity. I've experienced the sensitivity. Oh my God, it can be really nerve wracking sometimes, especially even when you're talking and air comes out or contact with air, it's just really sensitive. So you would have
Mm.
sensitivity. I'm being really honest here, right? You'll have sensitivity. All right, but we usually provide our patients with desensitizing paste. All right. And that usually helps them very well to cope with the sensitivity for the first 24 to 48 hours, depending on the patient. Yeah. And also, the other side effects is, if let's say, if at all the bleaching agent gets leached into your gums, then yeah, you might have like some inflammation of your gums for, like, a couple of days or so. Besides that, nothing much. Yeah.
Thank you, Dr. Ramithaa Venu. It just seems like I just started a talk session with you just less than 1 minute, but looks like it's already 60 minutes, 1 hour of,
Wow. Okay, that was fast. You were right.
told you, right?
Yeah.
Actually, in fact, our session should go like a series because there's so much of thing to understand about
Yes.
mental
Yes.
health. And of course, obviously, our topic today, what's our topic today? Sorry. Yeah, our topic is all about dental health. But the phenomenal thing about this is, most of the time we live in the body, but then we fail to understand how it operates. What are the precautions needed to be taken? But is this something that, like you mentioned something, your diet plays a very important part on the health of your tooth? Is it because of the calcium, or is it because of the minerals and vitamins? Is it also plays a
Yes,
very
yes,
important part?
definitely. Your
Yeah.
diet, I mean, your diet, what you eat, you're feeding your body that, right? So your teeth is also part of your body.
Yeah.
So what you feed your body is very important. So if you're going to be taking, high sugary snacks every day, you're going to start seeing breakouts. You might
Yeah.
eventually get diabetes. Your teeth
Yeah.
will get decayed.
Yeah.
There can be so many problems related to that.
Right.
However, if you eat like whole nutritious foods, all right, you're going to look different, you're going to feel
Mm.
good. It's also going to help you to get the necessary nutrients and vitamins to support the healthy
Right.
well-being of your gums and also your
Right.
teeth. Yeah.
Yeah.
So
I mean,
yeah, go on.
agree with you. I mean, you were saying something. Sorry. Go ahead.
No, that's why I said, a healthy diet is
Yeah.
very important. Yeah.
All right. So much of information. I think we have not covered that. I mean, we never even go into alcohol. We don't even talk about smoking.
Tobacco, smoking,
Yeah,
vaping.
tobacco, bitter leaves. The vetala.
Yes, yes, Vetala, I
Yeah,
know.
vetala. Oh, you can understand Tamil. I'm sorry.
Yes, yes, I can.
Okay. So the vetala, all those stuffs, we can even go into a different topic on a different segment. But thank you so much. There's so much of stuff that we learned today on what's your mouth telling you. For viewers who are watching this, please do share and like. And if you do want to get in touch with Dr., you can actually connect her with Instagram. That's us, Dr. Ramithaa Venu. You can actually look up over in Instagram. I mean, she done some of her videos while with the PPE, which I think I seen
Yes,
a couple
I'm
of them that
always
were
in
very
my
cool.
PPE.
Yeah, I always on the PPE, right? So I think it's a
PPE,
very
yeah.
important that you follow all the procedures. And thank you so much. Is there any final advice that you would tell to our viewers?
Okay, to all my viewers, to everyone who's listening, I hope
Yeah.
you visit your dentist every 6 months once at least. And please don't be scared of us. We're actually very nice people, and you just need to open up to us and tell us what's your problem, and we will see what treatment is best for you, and we will always strive to do the best for you. So I hope that all of y'all would start taking your dental health seriously, and I shed some light on probably certain aspects of dental health that y'all had doubts and things like that. So if y'all have any like other questions, I think y'all can maybe contact Vance maybe, or y'all could contact me through my Instagram. Yeah.
Thank you, Dr. Ramithaa Venu, for the past 1 hour plus of spending quality discussion on
Yes.
the part of the dental health we covered. And it was really in depth and lots of information we talked about. Thank you for taking your precious time. I know it's been a very busy day for you today. Probably no dinner yet, but you still have that 1 hour. I know you rushed back. And
Yeah.
behind the scene, right? There's so many things that's went behind, and then you made that effort to share. As we can see, so much of love that is pouring down right now from all our viewers. Say that thank you so
Thank
much,
you.
wonderful and awareness tips. We also have Vaman Vijay, nice one. Thank you so much, guys. Thank you, guys and girls out there. Thank you, Dr. Ramithaa Venu. We will stay in touch and probably do another segment.
Sure.
And all the viewers, you can also listen at Kopi with Vans podcast, Spotify, and Apple Podcasts as well. Thank you, Dr. Ramithaa Venu. Thank you so much. We'll stay
Thank you,
connected.
Vance, for having me. All right.
Thank you. Thank you so much. All right. Whoa, that's a solid 1 hour of Kopi events. I think I have already finished my coffee. That's right. And Doctor, I never even see her. She's drinking, right? But she was constantly, on the go and putting a lot of effort in and talking about that. That is Dr. Ramithaa Venu, one of our guest speakers from B.D.S, dental surgeon at VN Smile. Thank you so much for that. This is the thing, right? I mean, we often only react when the body gives us pain. By then it's a bit too late. But then doesn't mean that you can't get solution. But it's always important that if we can identify what's happening, I mean, you are living in the moment, which is very important. And if there's some kind of a sign or indications, right, we need to sort out that immediately, or at least within few days or within a day. If we don't, then it, like what Dr. Ramithaa Venu said, it swells up and then it can be still treated, but then it go through a lot of complications. That's go to the entire body system. If there's any pain or symptoms in your body, especially your shoulders giving you some kind of pain, it is not those just soreness from lifting up the book or you're sitting in front of the computer, but these are like sharp pains. And if you do experience any kind of sharp pains in your entire body, that means the body is communicating with you that something is wrong. But what we should do, as we are living in the body, we should take the necessary action. We need to look for help. That is why help is always in external. But if we don't look after our internal, then it's going to be tough. All right. This is the first time that we are doing a topic on dental health with Dr. Ramithaa Venu. It's really in depth information that she has shared with us at Kopi Events. As usual, every Wednesday, 9 p.m. at Kopi Events. If you want to get in touch with her, I mean, you have some kind of questions or you want to be connected or pay a visit for or visit on the next, like she said, 6 months once. This is her Instagram of us. You can always look up for her. I'm sure she will help out as well if you pay a visit for your dental checkup. All right. I don't have phobia anymore. I'm sure you also won't have that phobia anymore. Yes, sometimes dentists have to explain what is going in, what is coming out, especially with the sharp tools that we see. I got phobia, I got phobia during my younger days. I always tried to run away, like a student. I think I probably missed it. My parents were having the hardest time. I was the hardest kid. I'll be asking the dentist, what is happening? What is happening? And they said, no, shut up. So that kind of a phobia, like, I think if we explain, I think that is very, very pleasant, right? Then you want to go and see your dentist every day. Think about it. Your child saying, Mom, I want to see the dentist every day. That's amazing, right? You don't have to convince the child to go, because then it's very important. Because if you put a little bit fear on the child saying that, oh, if you don't study hard, if you don't do this, I'm going to send a dentist, then eventually when the appointment comes in or when an emergency comes in, then you're going to have a lot of difficult time. So always precautions is very important, and don't create any phobias in your child, because eventually that will be a challenge for you to convince. This is Vance from Kopi with Vance. I'll catch you on my next show every Wednesday, 9 p.m. I'm signing off. Adios, amigos.